There you go. Christian, Göran, we've got 35 people on already. We'll get some more, I have no doubt. I'm going to pass the baton on and get back to my technical duties and see if we can work out. Just for anyone who's new again, we record the session as we always do. There's some people have these sort of automatic AI bots and things that seem to be following us around. Just a little bit of care with them. And I think a special ask from everybody, particularly in the small group stuff, is that they should be bot and AI free if we can. I mean, we're relaxed about it for this stuff because we're recording. Exactly, Bishan, that's the thing. These bots just follow everyone around. They're you know, you don't know where they are now. They're out of control. No one knows how to get rid of it. Anyway, Göran, Christian, thank you so much for dreaming this up. Christian, huge thanks to you for being with us. Over to you.
Thank you, Bob.
Thank you very much.
What a lovely introduction. Christian, why don't you say hello to everyone first? Your
Hello,
name
everyone.
and where you work and so on.
Yeah, my name is Christian Farman, and I'm working as a registered nurse at the Rehab County Hospital here in Jönköping. And I also have an extensive patient experience. So, but I'm going to present that for you later on here. So.
Thank you, Christian. So, hello, everyone. My name is Goran Henriks, and it feels very good to be here together with you. Mostly because I, during the day, have had a full day with leaders where everybody has talked about how important AI and technology and that will change everything. So it's so good to come back to reality and talk about what means really something for the individual if you are in a need of a service from health and care. And I'm sure you will love the story that Christian will present. I have been asked by Christian to start the session and give a little platform. So what we will hear today are a way to reach people through different communication than we are used to. Quite often we talk about how am I communicating with my language to people, but we will try to give you an idea of that there are other ways to reach people's hearts and minds. And I like to start with a text from Nikki Macklin's article 2022, where she referred to John Holmes that said, "There is no exercise better for the heart than reaching down and lifting people up." Let's see if I know. So I thought we should start, as the idea of this session will be, with a little song that Bill Winters quite often represent and are referred to. So just relax and listen.
Sometimes in our lives we all have pain, we all have sorrows, but if we are wise, we know that there's always tomorrow. Lean on me when you're not strong, I'll be Just call on me, brother, when you need a hand. We all need somebody to lean on. I just might
So
have a problem that you'll understand.
I needed to do some technical changes here. Excuse me for that. I will very soon put you on the PowerPoint presentation again. I didn't find how to stop the music. That's how simple it was.
You're back in business, but everyone's got the song in their head, Göran, so you're
That's
in
great.
great space.
Thank you, Bob. So I hope you see the next PowerPoint very soon. So I think that this man, Desmond Tutu, really summarize why kindness are so important. He tried to teach young people in South Africa about Ubuntu. I am because we are. Ubuntu is a very difficult to render into a Western language. It speaks of the very essence of being human. You are generous, you are hospitable, you are friendly and caring and compassionate. You share what you have. It is to say, my humanity is inextricably bound up in yours. We belong in a bundle of life. Nikki Macklin and Hesham Abdallah tried to catch these ideas in the article from October 2022, when they wrote about that kindness is one of the greatest tools humanity has on offer to encourage flourishing beyond baseline for both the giver and the receiver. We can bring people along on our journey and our capacity for kindness. It is limitless if we choose to embrace this mindset. The sequence of help and being helped travel like a circuit through electrical wires. In effect, we are all conduits for the transmission of that energy. We do not own the actions anymore than a radiant heater can say it owns the heat that emanates from it. I think it's lovely summarized how important kindness is. Let me introduce Christian with another question. Britt-Marie Bank that you see on the picture here was a regular nurse, and she invited with kindness Christian and a friend to Christian, Patrick, to ideas of maybe trying to do it in a different way. This would never have happened if she hadn't understood deeply what kindness is. Let me, before I give Christian the word, tell a little story about both of them. By having been patients, they have a deeper understanding of what it means with co-production, co-design, and relationship. And they now, in different ways, pay this deep understanding pay it forward to the next generation or other people. So Patrick works as a patient supporter today, but he also has an interest in cars and running a garage in a social deprived in the city of Linköping. And people comes to this garage a couple of times per week, and they are not the regular people that you see in a school or at work. They comes from different kind of communities and societies, but they all love to come and join the dialogue around their cause, but at the same time they teach each other what life is and how a good life can be. And I think that Patrick developed this by being a patient in a relationship with Britt-Marie. Christian will tell his own story now. So Christian, I give you the word about something you and Claes have worked with the last couple of years.
Yeah, thank you very much. And first of all, I want to thank you everyone for being here today and for the invitation, because this is a huge thing for me to present MusikQafé that we have developed together. If you can take the next picture, Göran. MusikQafé, I have to introduce myself first here. I am Christian Farman, and I'm a licensed nurse with extensive medical history, so to speak. And also we have the music leader here, Claes Härnegård. He couldn't attend this session today because he felt a little bit ill, so he had to stay home. But he is a hospital volunteer with lived experience of serious illness, and he has running over 20 years music store here in Jönköping. So when I met him with my ideas about MusikQafé, we created this MusikQafé for patients, so to speak. And he also has a deeper understanding how it is to be ill and have a serious diagnosis, so to speak. Can you take the next picture, Göran? Here you can see myself and also Claes in the hospital settings where we were, and we are still patients, but we do good for other patients today. I was the flight technician who became the nurse after extensive health care, extensive patient experience. I've been undergone three kidney transplants and 2 years in self-care, and I'm also the first patient in Jönköping who became totally independent and took care of my own cares, so to speak. And that's the pictures you can see here. And you can see Claes at the treatment center for cancer here, and he has survived a severe cancer, so he is a hero for me. You can take the next picture, Göran. Göran, can you take next picture?
I thought, didn't you get the next picture?
No.
Yeah, we got it briefly.
From idea
We've got
to
it.
music.
Yeah. During the pandemic, I had to move. Let's see what happened here. Wait, yeah, here. From idea to MusikQafé. This is interesting because I couldn't work at the hospital during the pandemic, so I have to do something else. And then I got I have a I could go to the Kulturrum, the development unit in Jönköping, where Göran was the chief, and he helped me to stay there for a year or so, because it's pretty hard to stay at the hospital as a nurse when you are on medication for the kidney transplant. So at Kulturrum, I come up with an idea with the MusikQafé, and I talked to Göran about it, and he was really interested about it, because I told him what I think is important for the patients, and I showed him, and we developed this together. The Q in MusikQafé is stands for Kulturrum, because this couldn't be for real I couldn't do it without Göran, so to speak. So that was a really important thing. So I think we have tested it, and we have done so much things before we started it for real. So we really knew that the concept was a strong concept when we started to invite patients, and I think that was the key. You can take the next picture, Göran. There you have it. Now, before we go on here, I wanted to give you an example of what we do for our patients that we invite to the MusikQafé. And I want you to listen to a song who is composed by Jason Becker. And this is pretty much what we are doing. We are talking about something to a song or whatever, and we are talking about how it was created and stuff like that. So this song you're gonna listen to now is created by Jason Becker, a guitar legend and guitar prodigy and composer. And he was invited in the 90s to be in David Lee Roth's solo band, and he was invited to the tour, so to speak, and they wanted him to be the key guitarist, but after a couple of days or so, he felt like he couldn't play like he used to, and he had to end his performing career in a couple of months there in 1989 or 1990, I believe. And he was diagnosed with ALS, and he have lived with ALS since then. But he lost his ability to speak and move in 1996, and communicates only with eye tracking systems, and this system is developed by his father. And he also using computer technology to compose complex music. And that's what I want you to listen to now. And I want you to listen to it and feel your emotions, and think, what is this awakening you, and how can this music apply to you? And let's start it, Göran, and we can talk about it later.
You're at no sound yet.
There is no sound, I believe.
Yeah, Göran, I wonder about try the unshare and then reshare just with the with that little toggle on the sound, because I think they probably knock it off every time. Sit tight, everybody. I've had a preview of this, and I can tell you it's worth sitting in silence for half an hour to wait for this.
Can't you hear it, Bob?
Not yet.
You can't hear it?
No.
This is very strange.
I've put the link in, so if anybody else can share, put it up and share. I think I've picked the right one. So if anybody else is able to pick up and share, I'm not very good on Teams, so I won't offer.
So we had it working off your end, so let's just have one more try.
I don't.
Just a second, this is the wrong one.
Yeah.
I'm sorry. I'm gonna try to fix this. Take that down. And now I'm gonna go back to the presentation. And let's see.
Yep.
You can't hear it?
No.
A plan B could be to just everyone can click on it at the same time, because it seems to work when you click on that link. I don't know if others find it. We could listen to it.
I'm happy to share it if you'd like.
Why don't you try? I don't know. Sorry, I can't see who it is. I'd rather somebody else try than me, but I could give it a go. But if somebody else can, that would be great.
You should have a bar at the top as well, Goran, that allows you to select sound again if you need to.
Okay, let's try once more then. I go here. I do it again. Thank you very much. This is fantastic with technique. Do you see the picture, Jason Becker now?
No.
Would you like me to try?
Do you hear it now?
No.
You're not sharing at the moment.
No, we don't see it or we don't hear it. Maybe you should try, Nicola.
Sonia said I think she would, so I'm going to let her say go.
Okay.
Yeah,
Okay.
I think it was Sonia. Someone said they might be better than me. Yes.
What is your first feelings or emotions when you listen to this guy and what he accomplished with his body, his mind, despite his illness? Wonderful, wonderful. And this is what MusikQafé is all about. Can you hear me, guys? Yeah, this is what MusikQafé is all about. We are talking about about music and give the audience a little bit of a story, and then we let them listen to a piece, and then we have the existential thoughts and discussions, and we talk about really deep things, and we connect to each other with kindness and then warmth feeling. So you can take the next picture, Göran. Of course, before I started this journey with the MusikQafé, I have looked up the evidence for music in healthcare. So it's there, so to speak. You don't need to look very much of their evidence. It's there out there. So I don't need to say more than that. We have had live music on the MusikQafés too, and you can see that on the pictures here, and that's really amazing. You can take the next picture. And this is how it looks like when we come to MusikQafé at House of Hearts in Jönköping. And here we have invited the patients to this MusikQafé, and we have a warm, nice, cozy place where we can listen to music together, and we talk to each other with respect and dignity, and we open up about our lives and share moments in our lives that people have locked in deeply in their minds. And we have people who have cried about happy things, about things that are not so happy, but they are sharing it together because the music opens up with kind of the inner circle of your mind, so to speak. And that's so amazing. And we can take the next one. We have taken it further into the hospital because that was my main goal with the MusikQafé, was to take it into the hospital. And we have tested it out in there, and it became obvious that it should be there and it should stay there because we have 11 patients in the settings, and you see the picture here. I have to blur out the patients, but we have patients in beds, we had patients in wheelchairs and around the table to the right here. And we have such a pleasant journey this hour we spent together. This man in the wheelchair, he has a very severe illness, and he sat during the whole hour we were playing music. He was sitting there and jamming like I'd never seen him before. And the patient in the bed there, he was dying. He was really, really sick, but he lifted up and he was in the conversation, in the existential thoughts and discussions with us. So we really felt like this is beyond expectations, because we are going to continue with this in hospital settings. You can go further, Göran. Of course, we have done some evaluations about the MusikQafé, and I wanted to take some quotes from these evaluations, and you can read them for yourself. And this is for me, this is what MusikQafé is for me, and it's supposed to be. You know, one of them, let's see here. It was very positive, and it felt better than both pills and injections. This is helping me forward. And when you're in that room, something happens in that room together with the patients when you are doing this with music. So for me, this concept is here to stay, and I have talked to many people who are working with music therapy. This is not music therapy. We don't call it therapy because we call it MusikQafé. So, but they said you're banging in open doors when you're doing this, because we want more music on the hospital, in the hospital settings. So I think the evaluations and the voices from the participants is talking for itself here. I can take the next one. Yeah, that was everything for today, and I hope you can forgive us for the technical issues we had here, but I hope you can understand what I'm talking about here.
Wow, amazing. Christian, Göran, thank you so much. Now, Christian, I don't know how well we've briefed you on this, but if you're happy to stay with us for a little bit longer, what we're going to do, I think, and Göran, a check in with you, I think we should go into our breakouts for 10 minutes. Let's spend a little bit of time. And Christian, this is where the technology really goes crazy, because I press a button and randomly this wonderful group get thrown into about 7 or 8 different groups, and some of them gets so let's go and do that. And I think, Christian, your beautiful question of how did this make us feel, there's some amazing stuff in the chat. Göran, any other thoughts on what we should be thinking about, or just go with the heart, go with how we're feeling?
Yes, and I think give maybe other examples during the dialogue, other experiences of this.
Perfect. So we're going to go for a sharp 10 minutes. I'll bring everybody back just after 1:45. We can have a bit of a plenary discussion and a chance to say goodbye and thank you, and we'll go from there. So fasten your seatbelts. I'm going to open up the rooms. You know the story. It takes a few seconds. The tech's feeling a bit slow today, but we'll see you in a few minutes' time. Hello. You for technical reasons that nobody can explain, the three of you get stuck here with me in the main room. So lovely to see you. How's things going?
All good in Devon.
Fantastic. Bisham, whereabouts are you?
Still in Sweden, in the north. It's so good to see other Swedes in this.
I know. Listen, it's a Swedish takeover. That's fantastic. And Sonia, how about you?
I'm good, thanks. I'm in Edinburgh just now.
Fantastic. So come on then, guys. What did you think? What an amazing story. And I mean, we'll talk a little bit later about Christian and Göran doing this all in English and things. But yeah, Roberta, come on in. You're leading in on it. What did you think?
I liked the fact they called it MusikQafé. So it wasn't a therapy. It wasn't overtly any one thing. It was however people wanted to engage with it. And I've got to admit, I'm a little bit curious about the fact that different people have got different tastes in music. So did they have to choose music that would have a broad appeal to allow the most people to engage with it? Because some music's really angry and gets your emotions going in a different direction than maybe you'd want.
Great question. I mean, it creates opinion, doesn't it? In some ways, music and things. So listen, that's right. Who chooses the records or the jukebox feels quite important, doesn't it? Great. And I love your point about Christian was clear, wasn't he? He said, no, this really isn't. Music therapy is great, but this is not music therapy. Yeah, no, great stuff. Bishan, thoughts from you? What did you reckon? Do you know about it? Have you met Christian before?
No, I don't know. Actually, I know I've heard about Göran, so it was great to see him. But no, I haven't heard about any of this, and it was quite amazing actually, because I'm a big I'm a big muso. Like I am a bit of a street musician in a sense. Like I basically am the guy who plays the guitar and plays it badly so that everyone else feels comfortable to perform. And I'm big into jam sessions. I grew up with that because I've got the Sri Lankan background, and like it's really interesting because I just played some music with my daughters this morning, and I've been actually quite down and depressed in the last few weeks, and it was amazing that the music, it's just something that cuts through. And that's why I was thinking, I made that comment about for the patients. I mean, people who are struggling, which is pretty much every patient, to be able to connect with something that is very primal. And to me, I reckon it's that live element of being in 3D. So it was interesting to see how it worked in this, plane, but it really does connect with something.
It was very interesting, wasn't it? We obviously had some technical difficulties, and everyone's so gorgeous and sort of trying to lean in and help. And a very good suggestion was, well, we could all simultaneously listen to it. But really interestingly, I'm sort of glad that we just got it sorted, because there was something very special with knowing that we were all listening together in our different parts of the world. And boy, there's different parts of the world on this call at the same time. That, to me, that felt really it was different to being in a concert hall, but had that feel. It was like a sort of global concert. I mean, I can sort of see, I could get on a call and listen to some music with some mates across the world. That could be. It felt very different to me. Sonia, come on in. You're smiling.
No, I was just so I have to admit I had to do a bit of a bus stop pickup for my daughter who'd finished a running club, so I joined quite late. My question was around the word cafe. And I probably missed it because I missed the beginning of the talk, unfortunately. But what I want to know is if the word cafe just made it more accessible to people. Because currently I'm actually off work because I had to have some surgery. And what is interesting is I have suddenly become a patient and gone through the healthcare process, and I've been very lucky in terms of receiving lots of support. But every time I walk into and I'm a pediatrician, so I'm used to children's hospitals, so walking into an adult hospital is a strange experience for me because I work in a kids hospital, so that's fine. But it is interesting when people offer you therapy or supportive things, you kind of like, oh, do I need therapy? Oh, actually, that's right, because I'm not well at the moment, or I'm recovering from a procedure. And actually, you think about the word cafe. If it's like art club or music cafe, I wonder if it's just a bit more disarming and therefore easier for people to engage with. Because what's interesting is, despite going through a care experience, which has been excellent, I still don't think of myself as a patient, but I am. So
I think Sonia, I'm really interested by that because I've been a patient recently myself as well. I don't know if you can see, but I fractured my wrist really badly, and I've got 8 pins and a metal plate in there now. And one thing that really struck me when I was being a patient in Plymouth a couple of months ago was that people asked you what you would like a lot more than I thought would happen. I thought I would just be processed, that it's the wrist that's got to be fixed and you'll sit here and we'll do this to you. And I think it's that, you go to cafes by choice, don't you? And I got a real sense with this music cafe that people had a choice as to whether they engaged or not, and they would change the music maybe if people weren't engaging. So I think for me it's about choice.
Yeah.
I'm sorry that happened to you. I hope you're recovering.
We hope you're recovering well.
I think you're right. It is that whole pick and mix. So what will work for you? So art works for me. I'm trying to learn a musical instrument. I used to do a lot of singing in bands and gospel choirs and things like that. So singing and artwork would work for me, whilst sitting, I've been, there. I would agree with you, Roberta, because actually I was surprised with just how many touch points there are where people are offering you things, and it's almost like being, it's like if you walk into somewhere and it's almost overwhelming with the level of choice. So then that's when you have to be really clear on the things that you enjoy and you'll find helpful. So people have offered me other groups, but they're talking groups, and I just know I will go in there and I would want to hear how everyone is and care about everybody else. So I wouldn't, that's not the point, because I'm not there as the doctor or the best friend. I'm there for my own therapeutic journey. So it's interesting kind of thinking on it from different angles, but you're right. I suppose it's giving people a pick and mix of choice, and then adapting to those choices. And I certainly think it restores I think it restores your faith, because I think there is so much bad press out there, but actually for the unique human experiences of those experiencing care, we don't seem to highlight that enough. And things like that music group music cafe is exactly the sort of thing that needs to be celebrated, really.
I think one of the nicest things for me was being in a 23-hour ward and being sat near other patients. And because I'm a naturally chatty person, I chatted to the other patients, and there was actually people were coming across to my bed to talk to me because they liked that sociability.
Yeah.
And,
so, Roberta, there's an argument going on. Sorry to interrupt. There's an argument going on in England at the minute about new hospitals, and they're trying to sort of have a unified way of building new hospitals, and it's called Hospital 2.0 piece. But interestingly, one of the things they're really driving through, which many of us clinicians, and Sonia as a paediatrician, you all sort of buy. So our hospitals at the minute have got about, 15% single rooms. That's a problem and creates all sorts of difficulties for capacity. They want to go to 100% single rooms. It feels like a terrible idea. Now, you definitely want a higher percentage than we do now for people for reasons of immunodeficiency or infection or so. But Roberta, to exactly your point, if you were trapped away in a single room, you would have missed all those interactions.
Yeah, and about 11 years ago, I actually had pituitary apoplexy, and I was really unwell, and I was in a neuro high dependency unit for a few days. When I got better, they put me in a single room because I was better. They didn't need to observe me so much, and I found it an awful experience. I actually, the minute I could get out of bed, I was up walking around talking to the other patients again, because if you feel really unwell, that's the time to be in peace and quiet in the single room. When you begin to feel a bit better, you want to have that connection. The worst thing imaginable would be to die on your own in a single room with no human connection.
Yeah. Listen, we're going to bring everybody back, but come in, Bishan, just go for it. But you've got about 5 seconds.
One last thing. I mean, I heard this model for health recently, which is really mind-blowing. It's called NUMACORE, which is nutrition, movement, connection, and rest. And I tell you what, it's that connection which is so undervalued. It's in the blue zones. And I think what you just said, Roberta, I think one of the things about music is actually you just feel so connected at many levels. There's a presence. So, yeah, that's something that.
Fantastic, Bishan. Listen, welcome back, everybody. As all of you who've been on this call forever knows, I'm very diligent and careful. I count you out, I count you back in, and I think everybody's safely back here. I'm hoping, not that there's no hierarchy in here, but Christian and Göran are our most important people. Christian is safely back, I can see. I've lost Göran on my screen, but he's
I'm here.
You're
I'm here. Yes.
Oh, amazing. Come on then. Between the three of us, we're going to facilitate a bit of a discussion. We'd love to hear what you were talking about. We've got a question from our group, Christian. Who chooses what music?
Me and Klaus are sitting down and looking up pieces for every single meeting and adjust it for the right settings. And then we create a background story about every thing we are talking about and give the patients and the relatives who attend the music cafe a thoughtful mindset before we listen to the music.
So it's really curated and thought, and how wonderful.
Yeah.
How wonderful. Come on then, Christian, none of this lot are quiet. They might be pretending to be now, but let's hear from anyone. Stick your hands up, guys. There'll be stuff in the chat. I'd love to hear about what people were talking about and questions for Christian. Right, Sue's out the traps early. Sue, lovely to see you. Come and say hello.
Hi. Well, we had a small group, but we came up with so many ideas between us of things that we know about which involve music in groups, which make a massive difference. So Vicky talked to us, and in fact, but maybe I shouldn't give Vicky's up because Vicky unfortunately had to leave. But maybe we'll talk about Maureen's example of music therapists composing to a child's heartbeat. And that being something which is a sort of an ongoing memory of the child if the child has a terminal illness. And we do that as well at Noah's Ark Hospice. We compose to a heartbeat. We talked about the Forget Me Not Choir in Cardiff, which is a group of people with dementia who have them and their relatives all sing together. And very often these people with dementia don't communicate very well. But as soon as you get music going and as soon as you do songs and singing, everybody sings together. And we talked about on my ward at Barnet how for years we did Friday afternoon, patients, parents, staff all used to dance, led by one of our nurses who is an amazing street dance teacher. And that really, really raised morale. But all of these things need to be driven by one or two people who keep them going. You know, you can't, they really need energy.
Right, on that energy bit, Kath Krog, who sat in the middle of my screen. Kath, come on, tell us a little bit about some of the amazing things that go on in Australia and well beyond, thanks to your leadership around music. Then let's bring in Nikki to follow. But Kath.
Oh, no.
Thanks, Bob. Morning, everyone. It's only 3:30 in the morning, so I'm not my brightest, but thanks. So for about the last 25 years, I've been bringing composers into hospitals, and they work with patients and families, and they work with the staff, and it's extraordinary the impact on everyone. So we use the music in the operating theatres, and when you stand a composer in an operating theatre, they listen in a different way, I think, than we sometimes do. And then they reflect on it and they compose music that's to calm everybody down. And staff mention how it really helps to settle them, particularly if we've got anything urgent or upsetting going on, that the music keeps them really calm and it helps them to treat each other with kindness and respect. The composers say it's life-changing for them and that they compose differently once they've been in that clinical environment and they've talked to patients and families who are in really difficult situations, and they think about their music not just for a concert hall, but the impact that it's having on those individuals who are listening to it in their medical setting. Wow. So it's kept me really inspired in my medicine for the last 25 years to bring my creativity to work with me and to be bringing music everywhere.
Yeah, and Jill's put a lovely link in, and Kath, the work you do is so inspiring. It's always lovely to connect on in with it, and people who don't know it, please do go and have a look. Christian, a question for you that came up in our group a couple of, I think, Roberta and Sonia we were talking about the word cafe, and it felt a really lovely, helpful, inclusive, almost sort of non-clinical type word. We loved how in your presentation you said, no, this isn't music. Music therapy is very important, but this isn't music therapy. This is something different. Can you tell us a bit about the word cafe and the beautiful photo you had? You know, we all wanted to come in and have a nice flat white or something.
Yeah, the photo is an open photo I found on Unsplash, I believe. I think because I needed a warm photo, and
I
then
see.
you know, so that's I think it was that, but I don't remember exactly. But MusikQafé was I wanted to do something that was connected to Kulturum. So MusikQafé became MusikQafé because I wanted Kulturum to be in the center of the MusikQafé, because we developed this together with a developed leader, together with Goran Henriks and Klaus and me, and we did a lot of research about how to do it, and my idea from the beginning was pretty much this, but we could look up the evidence for music. So MusikQafé was the first name that came up here, and it became MusikQafé with a Q. Yeah.
You see, my knowledge of Swedish is just not good enough to know what cafe really should say. Göran, come on, you're too quiet and modest in the background. I've been lucky enough to come and visit Kulturum. We've got lots of wonderful friends on this call who may not have had that chance. Just give us, to Christian's point, give us a minute on Kulturum, on the culture and the spirit of learning, because to me it's no coincidence that these sorts of things bubble out of Jönköping and Kulturum. Do you want to just tell us a little bit about, come on, what's the secret sauce over there?
I think I very early learned that knowledge hierarchies, functions, rules become sometimes constraints in reaching people's minds. So I needed to create a place where people were people and not roles and functions. And we got the chance to get a meeting place in an old building that they wanted to just take away, and we restored it to a place where the colors are Spanish orange, very soft, green floors, a lot of light in many rooms, and the thing is that you need to have a format so people dare to widen the contours of their minds. And I think this is a kind of a lack of understanding in healthcare, because we are so rational and we are so production oriented that we forget that to reach another person you need to have a context or a place where you are invited to do that. So Kulturum is a meeting place where people can talk about serious things without being a function. They are a person.
I'm so pleased I asked that question. And there are opportunities, your amazing microsystems conference, and Annette is on the call. I think Chris Turner and I will offer to drive the minibus over there. We'll go via Australia and New Zealand. We'll do some pickups, and we'll see you there. But in all seriousness, it's a wonderful, wonderful place. Look, we've pretty much run up time. Christian, last word to you. I mean, I'm going to say some thank yous at the end, but any final reflections from you of this last hour and anything we might want to be thinking about going forward?
Yeah, last word is I think it's important to think outside the box, and really, if we talk about music, let the music play, so to speak, because I heard in the room I was into, and we were talking about that you already have music on hospitals in England, for example. But I don't think we use music in that way we should do it. So be brave and continue to try to get the music into the hospitals. I think that's the last word I want to say.
Christian, huge thanks. Göran, with huge thanks to you as ever for everything you do in this space. Any final thoughts from you?
No, it's fantastic to be with Christian, and I think we should also recognize that he is pay it forward living person, and I think kindness brings pay it forward strength. Thank you.
Yeah. Thanks so much, Göran. Christian, with great thanks, really from us all. It's been hugely inspiring. Please, will you thank Klaus for us? We love seeing his photos, being inspired by, and I very much hope he feels better, gets better very soon. Do come and join us anytime in the future. There's loads of great stuff in the chat as well. There's a really important piece that Sonia's put in as well. And Sonia, thanks for your email a bit earlier. And I haven't yet pressed play on this, but Andy Knox, who's just an extraordinary friend and colleague, who's a GP up in the northwest of England, has sung. He's so talented. I didn't know he could sing. Maybe he can't, but it sounds wonderful on there, and something really important about Suicide Prevention Day. Thanks for that, Sonia. There's so much other rich stuff in the chat. Listen, talking of rich stuff, we've got Rich Frankel. That was not rehearsed, I promise you. We've got Rich Frankel in a month's time. Rich is couldn't be with us today, but Rich is going to talk to us about sort of wide organizational change, about some work he and others did in Indiana. Typically, I managed to tease it out of him, this sort of modestly snuck out of this rather amazing piece of work. So that's going to be loads of fun. And we've got a really cool November and December. We might return to some music, I think, in December. One final thing, Göran, Christian, you're totally amazing for doing that in English. Your second language, or maybe even your third language, knowing you guys. It was just wonderful. Thanks for a fabulous hour. Thanks to everybody for joining, and take care. Have happy mornings, evenings, or wherever you're going, and we'll see you all soon. Take care now.
Thank you very much.